Hi, this is Scott Pop for Mobility Minute. We're going to talk about how I treat tendonitis and carpal tunnel problems of the wrist, forearm, and hand. Most of the time, tightness of the fascia, immobility of the small bones of the wrist, and tightness and strain of the tendinous attachments in the fingers are causing the problem. And it's the lack of spin that creates a lot of the tension. So how I treat the situation is the whole chain all the way from the neck, mid-back, and lower back out into the shoulder and arm. And we spin the arm both outward and inward, and I work the fascia in the opposite direction. So to work the fascia in the opposite direction, I take the wrist and I open up the palm, and I'm actually stretching the thenar of the thumb into extreme internal rotation. So you can feel the stretch of that. I'm taking the forearm fascia and I'm stretching it in the opposite direction so that we're getting a nice gentle stretch all the way up to the elbow. And I can take the thumb and I actually rotate it opposite again in an outward fashion. The first finger, I get into the thenar muscles of the wrist, stretch them again opposite to the rotation. I go through the whole wrist and fingers and I stretch the fingers because this creates good expansion of the tendons. And I really want to mobilize the carpal tunnel, which is right here. And so what I'm going to do is I'm going to stretch the carpal tunnel open. This helps reduce impingement to the median nerve, and it can greatly reduce or relieve pressure to that nerve, causing carpal tunnel syndrome. And then I go up into the upper arm, have the patient hold that, and I'm going to cross stretch all the way through the upper bands of the forearm. This is sort of like the IT band of the leg. And then I can go down into the forearm, the lower forearm here, and cross stretch the fascia of the flexor system. Then we want to reverse it. We want to go all the way internal rotation like this. And we're going to start at the wrist here. I'm going to open up the fingers, and again I'm going to stretch the wrist open. We're going to stretch the thumb. We're going to stretch the posterior part of it. We're going to stretch the first and second digits. I rotate as I stretch the digits, and I go all the way through to the hyperthenar area. We're going to completely internally rotate that, and I'm going to counter-rotate the forearm here. So we're going to stretch the fascia. This opens up the carpal tunnel. I'm going to get into the wrist, the little bones of the wrist here, and mobilize them. I'm going to go back here like this. I'm going to stretch, counter rotation, and then we take the PVC pipe and we work up in the forearm, upper arm here, and work the fascia. This stretches neurovascular tissue, tendons, fascia, nerves. It helps the gliding surfaces so that the nerve can move in between the gliding surfaces. And then we just work the wrist, external and internal. And I grab all the bellies of the forearm so that we get that good rotation around the elbow and the radial head, and the good rotation into the hand. We work it several times. Very, very effective at opening up the nerve and neurovascular bundles into the hand, and usually it feels really, really good. So this is Scott Pop for Mobility Minute on mobilizing the hand, forearm, wrist, and carpal tunnel. Thanks for watching.